Hi, this is Brian Kim. I want to share with you my updated hydrodissection technique. As you know, those who follow my channel, I perform capsule fornix hydrodissection technique, and it's a technique I developed which allows me to essentially perform a successful hydrodissection wave every single time in my first attempt when I do the wave. But this is one particular problem that I've identified. Even though I perform a successful hydrodissection wave, why is it that sometimes the lens refuses to spin even after I perform the hydrodissection wave? And so this updated technique is going to overcome this particular problem. And so first, let's identify what's going on. Again, this is capsule fornix hydrodissection technique. This is an illustration I took from that original video. And you can see the tip of the cannula is deep, embedded into the lens material contra-incisionally, and that's why the BSS fluid wave doesn't take a U-turn and burp anteriorly and have a failed attempt. And so it does propagate posteriorly really nicely, and it works very well. However, look at this picture. There is essentially capsular block when you create this situation. It's almost like a compartment syndrome. So if you have capsular block, what are you supposed to do? Naturally, the way we're taught is you're supposed to decompress the bag, right? So you decompress the bag, and it does two things. It allows that pressure to be relieved, but it also allows that fluid to further dissect the lens from the capsular bag. So it has twofold of a role. But this is a problem. Sometimes if you have weak zonules or loose zonules, even though you push down on the lens, it doesn't decompress. And so that is really the critical problem that really hasn't been discussed very much in hydrodissection techniques. And so how are you supposed to overcome a weak zonule or a loose zonule situation? You don't want to keep pushing down on the lens. Some people do that. I wouldn't advocate that. I think that's poor technique. You don't want to stress the zonules. Some people will just yank on the lens forcefully, but when you do that, of course, and you can get an effective rotation of the lens, but at what expense? You can cause zonular damage this way. So before I talk about my particular solution and how I'm able to overcome this problem and my updated capsule fornix hydrodissection technique, let's talk about my standard capsule fornix hydrodissection technique and how I'm able to effectively get a hydrodissection wave but yet have trouble spinning the lens. So you can see the case here. I've finished my rhexis and I'm going in with the cannula, pointed tip down contra-incisionally, get a nice fluid wave. You can see the scalloped edges of the hydrodissection wave. I'm trying to decompress. You saw a little bit of decompression there. I'm sweeping under the rhexis edge on the left side, pushing BSS as I do that. And then I'm trying to do the same thing on the right side. And I'm doing everything I'm supposed to do, all the proper maneuvers. I got a beautiful wave, but look, the lens just refuses to spin. The lens refuses to spin. I'm trying to be real gentle. I go ahead and try to hydrodissect a little bit more underneath the rhexis edge. I performed a hydrodelineation just there. And then you see I'm hooking the peripheral lens, trying to point the tip down of the cannula, trying to rotate it. But again, I'm very gentle. I never try to force the issue, but yet you can see the lens is not wanting to spin. And so it's because, like I said, there's capsule block syndrome. And so here, this is the new technique. I go contra-incisionally, point the tip down, get a nice wave. But look, I'm lifting the lens up. I lift the lens up. Again, the cannula tip is pointed down, and so I'm able to relieve that capsular block syndrome, and then I'm able to get perfect and beautiful rotation of the lens. No trauma or stress on the zonules. Here's another case. I place the cannula under the rhexis edge contra-incisionally, get a nice wave, lift the lens up, which decompresses the bag. I'm going underneath the rhexis edge on the left side and then the right side, and then the lens begins to spin. Again, as I'm finishing the hydrodissection, I'm lifting the lens up. So again, capsule fornix hydrodissection, contra-incisionally, get a nice wave, lift the lens up, and then I'm able to relieve the capsule block syndrome. And then I'm sweeping on the left side and then the right side, and then the lens begins to spin. I mean, it's so easy, and I'm not sure why I never thought about it before, but again, you have to think outside the box. Point the tip down, get a nice wave, lift the lens up, relieve the capsule block syndrome, sweep underneath the left side, and then the right side. So easy. The lens has no resistance now as I'm performing these techniques. So for this final case, let's show this in slow motion. I get under the rhexis edge contra-incisionally, point the tip down when I get to the capsule fornix, get a nice fluid wave. You can see there's propagation. The viscoelastic is coming out of the eye, and that's a sign that you're getting that wave. And then lift the lens up. It's tilting. Now remember, you might think this is stretching the zonules, but it's tilting within the bag. Remember, it's tilting within the bag. This is the same maneuver that people do when they're like flipping surgeons. Flip surgeons do this all the time. So you're just flipping the lens up within the capsular bag. It's not causing any zonular stress. Certainly a lot less zonular stress than if you're trying to just pull and yank on the zonules and the lens when it won't spin. Because there's so much friction between the lens and the bag. Why? Because of the capsule block syndrome that I was talking about. So again, this is my updated technique of capsule fornix hydrodissection. As you know, with capsule fornix hydrodissection, I never fail to get a hydrodissection wave. I never do. And this is why I feel this is the best way to perform hydrodissection. But again, I've noticed limitations because of the capsule block syndrome. Again, you push the BSS into the bag, you get the nice wave, you're feeling nice and triumphant, but all you've done now, yes, you've created a dissection wave, but now you have this high fluid pressure within the capsular bag. You have high intracapsular pressure, and this is a capsular block syndrome essentially. And then if you have weak zonules and you try to mash down on the lens to decompress the bag, it won't, and it won't relieve it. And so you don't want to stress the zonules. It's really bad technique. All you have to do, like I showed, is as soon as you finish with the wave, you already have the cannula there. Just lift it up. You can hook the peripheral lens because you're already there. And as you lift it up, it tilts the lens up. Only that pole of the lens is tilted up. Remember that. It's not causing any zonular stress. It's not causing any zonular traction. You're just tilting the lens within the bag. It relieves the capsular block syndrome. And lo and behold, the lens spins freely without any friction, without any traction on the zonules. And for me, this is a game changer. This was kind of a eureka moment. I don't know why I never came up with this before. But by adding this modification to capsular fornix hydrodissection technique, lifting the lens up, tilting it so that you can relieve that capsular block syndrome within the bag, now the bag is completely unpressurized, and of course, the lens begins to spin really, really easily. Again, not difficult, not rocket science, just common sense. And you saw in these cases a perfect illustration of what I was just saying. Once you relieve the capsular block syndrome, you should not have trouble spinning the lens. So I encourage everyone to try this technique with this modification. I think if you do it, you're going to find hydrodissection will not be a frustrating step for your surgeries. It will be an easy, basic, kind of a no-fuss part of the surgery, and it'll just make your surgeries go much more smoothly, much more easily, and make cataract surgery a lot more enjoyable for you. And more importantly, it will allow the patient to have less stress on the zonules, safer approach, safer for the patient. And of course, that's what it's all about when we're taking care of patients, when we're doing cataract surgery. So I hope this was helpful to you, and I thank you for your attention.